Exforge tablets is used to treat high blood pressure. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. This product contains two medications, amlodipine and valsartan. They both work by relaxing blood vessels so blood can flow more easily. Amlodipine is a calcium channel blocker, and valsartan is an angiotensin receptor blocker. Indications: treatment of essential hypertension. Exforge is indicated in adults whose blood pressure is not adequately controlled on amlodipine or valsartan monotherapy. How to use. The recommended dose of Exforge is 1 tablet per day. Exforge 5 mg, 80 mg may be administered in patients whose blood pressure is not adequately controlled with amlodipine 5 mg or valsartan 80 mg alone. Exforge 5 mg, 160 mg might be administered in patients whose blood pressure is not adequately controlled with amlodipine 5 mg or valsartan 160 mg alone. Exforge 10 mg, 160 mg may be administered in patients whose blood pressure is not adequately controlled with amlodipine 10 mg or valsartan 160 mg alone, or with Exforge 5 mg, 160 mg. Exforge can be used with or without food. Individual dose titration with the components amlodipine and valsartan is recommended before changing to the fixed dose combination. When clinically appropriate, direct change from monotherapy to the fixed dose combination may be considered. For convenience, patients receiving valsartan and amlodipine from separate tablets capsules may be switched to Exforge containing same component doses. Contraindications: hypersensitivity to the active substances, to dihydropyridine derivatives or to any of the excipients, severe hepatic impairment, biliary cirrhosis or cholestasis, concomitant use of Exforge with aliskiren-containing products in patients with diabetes mellitus or renal impairment, second and third trimesters of pregnancy, severe hypertension, shock including cardiogenic shock, obstruction of the outflow tract of the left ventricle, hypertrophic obstructive cardiomyopathy and high-grade aortic stenosis, hemodynamically unstable heart failure after acute myocardial infarction. Precautions: don't use Exforge if you are pregnant. If you become pregnant, stop taking this medicine and tell your doctor right away. If you have diabetes, don't use Exforge together with any medications that contains aliskiren, such as samtinide, Tectona, Valterna or Tecamla. In rare cases, Exforge can cause a condition that results in the breakdown of skeletal muscle tissue, leading to a kidney failure. Call a doctor right away if you have unexplained muscle pain, tiredness or weakness, especially if you also have fever, unusual tiredness and dark color to urine. Don't use potassium supplements or salt substitutes while you are taking Exforge, unless a doctor has told you to. Avoid getting up too fast from a sitting or lying position, or you may fall dizzy. Get up slowly and steady yourself to prevent a fall. What to avoid? Drinking alcohol can feature lower your blood pressure and may cause side effects. Exforge may impair your thinking or reactions. Be careful if you drive or do anything that requires you to be alert. Exforge side effects: get emergency medical help if you have signs of an allergic reaction to Exforge, hives, difficulty breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once if you have a lightheaded feeling like you might pass out, swelling in your hands or feet, rapid weight gain, or signs an electrolyte imbalance, dry mouth, increased thirst, drowsiness, confusion, feeling restless, vomiting, muscle pain or weakness, lack of energy, fast heartbeat, little or no urinate, or asasia. Common Exforge side effects include swelling in your hands or feet, headache and dizziness, cold symptoms such as stuffy nose, sneezing, sore throat,